Hey, Dr. Cat epidemiologist. I did a Q&A last week about COVID-19 vaccines on my Instagram, and this was my most frequently asked question. Which COVID-19 vaccine should I get? So if you're a healthcare provider listening to this, this is probably something your patients are also wondering. Here's a true story. My son and I went to the drugstore on the corner to get the COVID-19 vaccine in September. And I made our appointments online, and I honestly didn't know which vaccine we were getting until we got to the pharmacy. So my recommendation when people ask me that is for people to just get whatever vaccine is most easily available to them. All of the approved vaccines, I like to remind people, have been updated to match more recently circulating strains. Now, Novavax targets a variant called JN1, and the mRNA vaccines are targeting the flip variant called KP2. Currently in the US, the strain KP.3.1.1 comprises most of the circulating virus. But all three manufacturers presented data showing that these vaccines all had neutralizing antibody activity against KP3, which is very closely related to the currently dominant strain. All of these strains that I mentioned just now are all still in the Omicron lineage and are all in the same family of viruses. They all stemmed from JN1. So they only have slightly different changes to their surface proteins. Some other points to remember about the COVID-19 vaccines is that this is not a booster, but it's rather an updated vaccine that's kind of more like an annual flu shot. Another thing I like to remind people is that all the new vaccines are effective at preventing severe illness from COVID-19, and there's data now to suggest that the vaccines reduce the incidence of long COVID. Lastly, it's a great time for people to get the vaccine now if they haven't already gotten it, and you can even get it at the same time as your flu shot. Getting vaccinated regularly with the most up-to-date COVID-19 vaccine is critical for staying safe because the virus mutates.